I'm Ethan, and to start our bone presentation, I'll be doing the lateral view of the skull. So to start, we have the frontal bone, then we have the parietal bones on each side, then the occipital bone, and we have the temporal bone, then we have the mandible, and the mastoid process. We have the external acoustic meatus, this thing right here. And the sphenoid is right here. I don't know if you can tell. We have the supraorbital foramen there. We have the nasal bone here. We have the lacrimal bone inside of there, right there. And then the ethmoid bone right behind it, in there somewhere. And also the maxilla, which is, right there. And the zygomatic bone, which is right here. We also have the coronal suture, which is right here. We have the squamous suture, which is that ridge right there. And we have the lambdoid suture, which is right here. Am I missing something else? Yes. The styloid process is this little thing right here. I forgot to do the zygomatic process, which is this, and the temporal process, which is somewhere right here. Next is the anterior view. Just a couple things you couldn't see on the lateral view. First, we have the palatine bone, which is way back in there. It's super tiny. I don't even know if you can see it. It's right there at the edge of my finger. And then we have in the nose, the inferior nasal concha right here. Then we have the perpendicular plate, which is right there. And then we have the vomer. Next, we have the inferior view of the skull. First, we have the mandibular fossa, which is right next to the styloid process. That little spike thing is the styloid process, and that's the mandibular fossa. Then the occipital condyles, which, these two right here, there and there. Then we have the jugular foramen, which is this hole, these holes here and here. And then the foramen magnum, which is this giant hole. And then last is the carotid canal, which are this hole and this hole right here. Next, we have the superior view of the skull. Right there is the olfactory foramina, and right on top of that, right there is the crista galli. Then right under that is the cribriform plate, and then the stella turcica is right there. I forgot to do the lateral view, or part of the mandible on the lateral view. We have the mandibular condyle, the coronid process, and the ramus, or ramus, I don't know how you say that. These are the auditory ossicles, or the three bones of the ear that I drew because I could not find them in the study lab. First, we have the incus, then the malleus, and last is the stapes. Next is the spine, the vertebrae of the spine. The first 7 are the cervical vertebrae. The next 12 are the thoracic vertebrae. And then the last 5 are the lumbar vertebrae. Next, I'll do the major parts of a typical vertebrae. First is the vertebral body, which is this right here. The laminae, which is up in here. Oh, no. Down there. The pedicle, which is right there. The articular processes. This is the superior, and this is the inferior. And this is the spinous process. What? Also, this is the transverse process. These are the lateral articulating surfaces, and this is the intravertebral foramina. And these are the transverse foramina. These little holes right here. And last for the spine is the atlas and the axis, which are C1 and C2, and also the dens, where'd it go? Which is right in there. Next, we have the little skeleton to do the ribs. This blue stuff is the costal cartilage. The head is where it attaches to the spine, and the tubercle is the middle part right there. There's also true ribs, floating ribs, and false ribs. And finally, we have the sternum with the manubrium at the top, the body in the middle, and the xiphoid process. Correction, the xiphoid process.
My name is Presley, and for my part of the bone presentation video, I'm starting with the pectoral girdle. Here we have a left clavicle and the medial and lateral ends. Moving on to a right scapula, we have the glenoid process, the acromion and the coracoid process. We have the superior border, lateral border, and medial border, and the subscapular fossa. From the posterior view, we have the infraspinous fossa and the supraspinous fossa, and the spine. Next, we have a humerus. We have the head, the greater and the lesser tubercle. We have the surgical neck and the intertubercle groove. We also have the capitulum trochlea and the 2 medial and lateral epicondyles. And the little hole right here is the nutrient foramen, and this hole here is the olecranon fossa. Moving down the arm, we have a radius, we have the head, and this here is the styloid process. For the ulna, we have the olecranon process, the trochlear notch, the radial notch, and the styloid process. Moving on to the bones of the hand, proximally we have the carpals, medially we have the metacarpals, and the phalanges are distal. Moving on to the pelvic girdle, we have the 2 hip bones here. The main parts are the ilium, the pubis, and the ischium down there. We have the pubic symphysis, the greater sciatic notch, the ischial spine, the coccyx, and the sacrum. And right in here where your femur attaches is the acetabellum, and the obturator foramen is these holes down here. And for the last view, we have the iliac crest, the ischial tuberosities, and the pubic arch. Moving on to the leg bones, we have a left femur. Starting with this hole here, it's the fovea capitis. This is the head of the femur, the neck. We have the greater trochanter and the lesser trochanter. This line right here is the linea aspera. We have the lateral and the medial epicondyle. Moving on to the tibia. Up at the top, we have the intercondylar eminence, and right here is the tibial tuberosity. Right here is the medial malleus of the tibia, and on the fibia is the lateral malleolus. Lastly, we have the bones in the foot. This top bone up here is the talus, where the tibia connects. Down here is your heel, which is the calcaneus. We have the tarsal bones, the metatarsal bones, and the phalanges.